Hi friends, welcome to Jellyfish Nursing channel. Today we are going to see the pediatric questions. So let's go. Maximum development of the brain occur at which age group? A. Infancy and B. Adolescent and C. School going age and D. First trimester of pregnancy. So the correct answer is infancy. Usually that all the brain development will be occur at the age group of infancy only. Next question. Bone dysplasia is due to what is a deficiency? A. Vitamin deficiency and B. Hormonal imbalance, C. Faulty nutrients and D. Faulty development. So usually it was happen in the because of the genetic disorder. So the correct answer is what is that? Faulty development. Okay, next question. Hormone responsible for skeletal maturation of fetus. So what will be the main hormone? And A. Estrogen, B. Testosterone and C. Thyroxine and D. None of them. So the correct answer is thyroxine because is most of the regulator fetal development it was happened because of the help of the thyroid hormone also in the adult metabolisms are important. So next percentage of polio infection which are asymptomatic. So most probably the what is the percentage of asymptomatics? So the correct answer is, so you can see that first A 10%, B 1% and C 20% and D 90%. So the correct answer is 90%. So next, the child takes self decision at the age of A 7 years and the B 3 years and C 9 years and D 1 year. So when the child is going to take the right and wrong decision like that, so the correct answer is 7 years. Okay, next question. The reference of protein is A rice and B egg and C fish and D lemon. So you know that it is rice is mostly it is you know that it will be the carbohydrate and fish and lemon fish also it is egg also protein but lemon it's vitamin C. So the most probably the correct answer is egg. It is a full protein. So that is a correct answer. Next question. The newborn failure to pass meconium within the first 24 hours after birth may indicate which of the following. So usually that A. celiac disease and B. Hirschsprung disease and C. abdominal wall defect and D. intussusception. So you know that it is, so usually it was happen in the Hirschsprung disease because the failure of the large intestine that can't able to be passed the stool it because of the involvement of the muscle and the nerves problem it is. You can see the Hirschsprung disease, you will get the answer. And next D. A child reference to the emergency room with the history of ingesting a large amount of acetaminophen for which of the following would the nurse assess? A. Frequent maturations and B. hypertension and C. right upper quadrant pain and D. headache. So you know that it is when the baby is taking or anybody is taking acetaminophen, so which part is going to be affected? First will be the liver. So that will be the correct answer means the liver is going to be damaged. So you will be the getting correct answer right upper quadrant pain it is. Okay, fine. Next question. The nurse is aware that the most common assessment finding in a child with ulcerative colitis is, so what will be the cause? Ulcerative colitis. So that the ulcer is going to happen in the colon. So A. anal fissure and B. profuse diarrhea and C. abdominal distension and D. intense abdominal cramps. Can you guess the answer? It is a colitis. So most probably in the colon. So that will be the answer is profuse diarrhea will be happen for the what is that in the ulcerative colitis. Sometimes it's bloody diarrhea or with or without mucus also it was happen. Okay, fine. Next question. Failure of the foramen ovale to close with cause what congenital disorder? So A. atrial septal defect and B. Toto anomalous pulmonary artery and C. transposition of great arteries and D. pulmonary stenosis. You know that it is one of the congenital disorders. This is foramen oval. So foramen oval where it was happened most probably in the atrial part. So that means, so the correct answer is what is that? Failure of the foramen oval means that is atrial septal defect. So that will be the correct answer. So in the next question, a fetus has fine downy hair which is called. So what is the answer? Amnion, vernic gaseosa, chorion, lanugo. So you know that amnion and corian is the covering layer. Wernic caseosa, it is a white mash material, and that means what is the hair will be present means that is called it as lanho is a correct answer. Okay, what is the next question? It is neonate of diabetes mother is at risk for all the following except. So what will be the correct answer? A. Hypoglycemia, and B. Hyperglycemia, C. Hypocalcemia, and D. Hyperbilirubinemia. So you know that the mother is having diabetes. That means what will be the main? So hypocalcemia and also hypoglycemia and hyperglycemia. So what is the question? They are asking except. So the correct answer is hyperglycemia. Okay, fine. Next question. In children, which disease occur due to protein deficiency? Most probably, what is that? So A. marasmus, and B. kwashiorkor, and C. beriberi, and D. scurvy. So what is the correct answer? That is kwashiorkor. Okay, next question. PCG vaccine is given at, it's going to prevent what is the condition? A. tuberculosis, and B. polio, and C. measles, and D. diphtheria. So you know that it a PCG vaccine is given for only particularly for tuberculosis. Okay, so that will be the correct answer. The Apgar scoring is done to appraise the infant for A. RH sensitization, and B. respiratory effort, and C. birth defect, and D. emotional stability. So you know that it is Apgar score is going to be find out the respiratory effort it is. That will be the correct answer. So next question. Immunoglobulin found in human milk, colostrum especially, and also vaginal secretions and tears is, so which immunoglobulin is present? A. immunoglobulin G, and B. immunoglobulin M, and C. immunoglobulin A, and D. immunoglobulin D. So what will be the correct answer? That is immunoglobulin A is the correct answer. It was found in the mucous secretions, breast milk, vaginal secretions, saliva, tear, even respiratory tears also. It is the immunity, it is mainly present in most of the human milk also. So what is the next question? Quickening occurs at which weeks it is? A. 5 to 10 weeks, and B. 10 to 14 weeks, and C. 20 to 24 weeks, and D. 16 to 20 weeks. So you know that it is what will be the correct answer is. So most probably it was happen in quickening in the 5th month. So 16 into 20 weeks is the correct answer. The next question. What is a normal fetal heart rate? So you know that 120 to 160 will be the regular heart rate, will be the fetal heart rate. That is a correct answer also. Next, AIDS is not transmitted from mother to baby. A. placenta, B. breastfeeding, C. skin to skin contact, D. all of above. You know that it is placenta and breastfeeding is, it's not a correct answer. So that will be the correct skin to skin contact. That will be the correct. Next question. Complication of diabetic mother delivery. A. shoulder dystocia, and B. placenta previa, both A and B, and D. abrasive placenta. So usually diabetic mothers having baby will be big. So most probably the what will be the complication? That is shoulder dystocia. Next question. Maternity nurse must be aware that screening for diabetes mellitus in pregnancy is done at A. 18 to 23 weeks, and B. 6 to 17 weeks, and C. 24 to 28 weeks, and D. 29 to 32 weeks. You know that it is in the first and second trimester the insulin will be normal, but it's going to be third trimester is going to be increase. So most probably, so that 24 to 28 weeks will be the correct answer, because insulin resistance will be more in the women it is. Okay, so the correct answer is 24 to 28 weeks it is. Next question. Which one of the following is not a described type of female bony pelvis? So you know that A. obstetroid, and B. gynecoid, C. anthropoid, and D. android. So which of the following it is mostly you know that. So what are the types of pelvis? 4. So gynecod, android, anthropoid. So obsteroid, that will be the correct answer. Next question. So secretion of breast after delivery is known as A. cortisone, B. thyroxine, C. prolactin, D. colostrum. So you know that secretion of breast milk after delivery is known as, what is the correct answer? Colostrum. Yeah, the breast milk, if it is, what is the stimuli, that will be the prolactin, but colostrum is the correct answer. A positive early diagnosis of pregnancy is based on the presence of A. fetal heart rate, B. quickening, and C. Sadwick sign, and D. human chorionic gonadotrophin. So what will be the correct answer? How you will confirm the pregnancy? With the help of the HCG only. So that is a correct answer. That is a early diagnosis of pregnancy. Next question. Which immunity present in the human milk? Active natural immunity, and B. active artificial immunity, and C. passive natural immunity, D. passive artificial immunity. So the correct answer is passive natural immunity. That is the correct answer. Next question. Iron requirement during normal reproductive age group. So what will be the correct answer? A. 3.2 to 3.8 mg, B. 2.8 to 3.8 mg, and C. 4 to 4.8 mg, and D. 1 to 2.5 mg. So the correct answer is 1 to 2.5 mg. So that will be the 1000 kilocalories according to this RDA value. Okay, fine. Next question. So fertilization taken place in fallopian tube in the which part of the fallopian tube? Okay, A. infundibulum, B. Bimbriae, C. ampulla, and D. isthmus. So the part of the fallopian tube it was happened. So most probably the correct answer is ampulla. That will be the correct answer. Next question. The first fetal heart sound can be assessed by 8 to 10 weeks, and B. 2 to 3 weeks, and C. 18 to 20 weeks, and D. 10 to 12 weeks. So what will be the correct answer? The first fetal heart sound is going to be detected at in the 3rd month, most probably in the 10 to 12 weeks of pregnancy. That is the correct answer. Okay, next question. After the membrane rupture, what is the priority assessment for the nurse? After the membrane rupture, what is the priority assessment for the nurse? A. fetal heart rate, B. blood pressure, C. presentation, D. pelvic exam. So what will be the correct answer? Whenever this membrane is going to be ruptured, so the first correct answer is fetal heart rate. So next question. Movement of the baby felt by the mother is known as. So what is that? A. lightening, B. quickening, C. engagement, and D. ballotment. So what will be the correct answer? Quickening is the correct answer. Next. Total weight gain during pregnancy is about, so A. 5 kg, and B. 11 kg, and C. 8 kg, and D. 13 kg. So usually the total month is going to be 9 months 7 days, is going to be gain the weight 11 kg. So that will be the correct answer. Next, commonest complication of IUD insertion is, so IUD, what is that? A. pain, and B. bleeding, and C. perforation, and D. ectopic pregnancy. So most commonest complication is bleeding is the commonest complication of IUD. Okay, fertilization occur in A. pelvis, and B. fallopian tube, and C. uterus, and D. vagina. So where it was happened that fertilization, it was happened place in the part of the fallopian tube only. So the correct answer is fallopian tube. Next question. Pap smear is used for screening of which of the following? Pap smear is used for screening of which of the following? A. cervical cancer, and B. ovarian cancer, and C. breast cancer, D. endometrial cancer. So what will be the correct answer? Cervical cancer is a correct answer because papsmear is going to be detect the cancer of the cervix.